So, welcome everyone. Welcome members. Welcome a lot of familiar faces. Thank you again, Paul. And I just feel so very humbled to have such a wonderful introduction and to be invited to speak to you this evening about with the Beyond Barriers lecture series. In the spirit of CSDH's very strong desire, all of us, wanting equitable access to oral health care, I'm very humbly going to share with you some of the tips and strategies that I learned over my meandering career. And for some of you, this is going to be a review because you're the experts already, and you probably can teach me quite a thing or two. And for others, I hope that there's lots of pearls and new information for you this evening. So first of all, I just want to declare that I have no actual or potential conflict of interest in relation to this course. No money is exchanged. I'm not sponsored by anyone. It's just me, retired me. And then, unless otherwise stated, all the images in this presentation are open source and readily available on the internet, except for you'll see some of my area where I live on Vancouver Island. Just to spruce up a few slides, I thought I'd share with you a little piece of the heaven that I live in. So our plan for tonight, really, I thought a great place for us to start is really to dive right into the definition of disability, see how others define it, how we define it, and some of the related terms that I think we all need to make sure that we have sorted out in our heads. I'd love to introduce you, if you haven't met, World Health Organization International Classification of Functioning, and you'll get that from my title of this presentation, it's all about function, caring for with people with disabilities. So it really takes the negative out of disability and puts us into a person-centered approach. I'll elaborate on some strategies and helpful tools that you may not be aware of, and then talk about some opportunities like Special Olympics, Special Smiles, and along with a few key takeaways. So as a academic for many years, I thought I would include some learning objectives, and you'll learn and hear about a whole bunch of different things, but I wanted to focus four things that I'm pretty confident you're going to walk away with if you don't know this information and be able to have a dialogue with members of your team and your colleagues, maybe even your family and friends, because I find oral health kind of gets into just about every conversation around the table. So by the end of this webinar tonight, I think that you will be able to examine and discuss the challenges of current terminology and definitions related to this population and discuss the prevalence of disability in Canada and its impact on your clinical practice and mine, and propose strategies that could be implemented to better meet the needs of persons living with disabilities wherever you practice. And finally, I'm really hopeful that if you haven't yet done it, you're going to adopt a person-centered functional approach to care. So, you know what? I just included this because I wanted to just say that, just I was very inspired in 1992 when I was finishing my dental hygiene diploma and sitting through the community practice course. There was a guest speaker, and her name was Rhonda Plett. She was a dental therapist who took dental hygiene training, and she became the director of the Rural Oral Health Program for Manitoba government. And she solely, I'm sure with members of her team, developed a program so that there was in every rural school, there was a dental clinic and a dental therapist. And it was a fabulous program. But I sat in that classroom with Professor Laura McDonald, who was teaching it, and I was so inspired. That's where the flame was lit for me to work with vulnerable populations and underserved populations. And my story just continues from there. I worked in private practice for 5 years, and then after that, I equate these opportunities to the door kind of cracking open just a little bit. And I took on becoming a clinical director. I did that a day a week. And the next year, there was an ad for a health promotion specialist with the university's outreach arm, where students kind of rotated through all the externships. And we had dental teams that would go into long-term care up to remote areas in Baffin Island to Churchill. You can see my polar bear there. We ran the children's oral health program for Kibblick, the surgery, and oh, just so many places, into institutions for quite significantly developmentally disabled individuals. So through this whole time, I was practicing a day a week, and I went in with a tackle box and a kneeler. I sang a lot of old songs that my parents sang when we were on road trips. That's what you do with 6 kids in small cars when we were little. And, found ways to soothe people who were in distress and learned a lot as I went along the path.
Okay. Uh, Carol has been involved in the same vein of serving people, I repeat, from 2010 to the present as a coordinator and regional clinical advisor of the Special Smiles screening program for Special Olympics International. Another paragraph. Carol has consistently exhibited a penchant for excellence through her high levels of leadership in the responsible and demanding jobs and projects she has taken on. She definitely has advanced the profession of dentistry in her roles as professor and mentor, and with her exceptional contributions to many aspects of society, so well executed through the lens of dental hygiene. Over the years, Carol has worked on many collaborative projects which have produced a spectrum of educational materials, showing her desire to reach out and help build bridges for the betterment of people in our society. Let us look at 3 of 21 projects that illustrate this. From 2001 to the present, demonstration kits are being produced for perinatal, adult, and long care target groups. A teaching game project named Dental Mythbusters was completed for developmentally challenged individuals in 2004. In 2007, there were 10 how-to video clips produced for mouth care training for caregivers. Okay. Carol is a creative collaborator in the promotion of oral health, well-being for vulnerable populations, and she has pursued countless opportunities to do so, both professionally and through her volunteer experiences. She has been the president of the Canadian Dental Hygienists Association 2007-2008 and governor of the National Dental Hygiene Certification Board 2012 to 2015. Along with her colleagues, she gave of her energy and profound enthusiasm to guarantee the passage of the Dental Hygienists Act in Manitoba in 2005. Carol has received many grants and awards over her storied career. Most recently, she was Canada's first ever winner of the Golisano Health Leadership Award in 2016. This award recognized Carol for her dedicated volunteer work with Special Olympics on behalf of individuals with intellectual disabilities. In October 2022, Carol received the very prestigious award of honorary membership in the American College of Dentists. Ladies and gentlemen, Carol Yakachuk.
Wow, Paul. I mean, I don't think I can live up to that intro. It's so beautiful. I don't know if that's truly me, but thank you so much for that. I'm just going to get my presentation up here and then talk about some opportunities like Special Olympic Special Smiles and along with a few key takeaways. So as a academic for many years, I thought I would include some learning objectives, and you'll learn and hear about a whole bunch of different things, but I wanted to focus four things that I'm pretty confident you're going to walk away with if you don't know this information and be able to have a dialogue with members of your team and your colleagues, maybe even your family and friends, because I find oral health kind of gets into just about every conversation around the table. So by the end of this webinar tonight, I think that you will be able to examine and discuss the challenges of current terminology and definitions related to this population and discuss the prevalence of disability in Canada and its impact on your clinical practice and mine, and propose strategies that could be implemented to better meet the needs of persons living with disabilities wherever you practice. And finally, I'm really hopeful that if you haven't yet done it, you're going to adopt a person-centered functional approach to care. So, you know what? I just included this because I wanted to just say that, just I was very inspired in 1992 when I was finishing my dental hygiene diploma and sitting through the community practice course. There was a guest speaker, and her name was Rhonda Plett. She was a dental therapist who took dental hygiene training, and she became the director of the rural oral health program for Manitoba government. And she solely, I'm sure with members of her team, developed a program so that there was in every rural school, there was a dental clinic and a dental therapist. And it was a fabulous program. But I sat in that classroom with Professor Laura McDonald, who was teaching it, and I was so inspired. That's where the flame was lit for me to work with vulnerable populations and underserved populations. And my story just continues from there. I worked in private practice for 5 years, and then after that, I equate these opportunities to the door kind of cracking open just a little bit. And I took on becoming a clinical director. I did that a day a week. And the next year, there was an ad for a health promotion specialist with the university's outreach arm, where students kind of rotated through all the externships. And we had dental teams that would go into long-term care up to remote areas in Baffin Island to Churchill. You can see my polar bear there. We ran the children's oral health program for Kibblick, the surgery, and just so many places, into institutions for quite significantly developmentally disabled individuals. So through this whole time, I was practicing a day a week, and I went in with a tackle box and an eeler. I sang a lot of old songs that my parents sang when we were on road trips. That's what you do with 6 kids in small cars when we were little. And, found ways to soothe people who were in distress and learned a lot as I went along the path. Um, Paul has already said it all. I think, you know what, I've kind of done everything I think that dental hygienists can do. I've done research and all of that jazz. A very special place in my heart is First Nation individuals, and I managed the oral health program and retired from there for BC. So, you know what? Just in your career, if you are starting out, don't think about no opportunities. Look for those doors cracking open and just really have the time of your life. And probably lots of people on this call have had these adventures. But I just wanted to share that I've definitely had my hands with gloves on and wet in many, many areas. So I'd like to hear now from you. So, Barbara, we have a poll question. All right. So where are you physically located? And you can select an answer. You just click on that drop. Hmm. It's not showing me. Hopefully other people are seeing that. It just says select an answer, Barbara, and it doesn't really let me. And
Ne malo.
pardon?
Never the driving mabet.
And
Ne malo.
pardon?
Never the driving mabet.
And
Ne malo.
pardon?
Never the driving mabet.
Okay.
Let me, I open up presentation and I will share. Oops.
What do you think that lady's trying to do?
Oh, it's giving me weird screens. There we go.
Okay. Ladies and gentlemen, it's 7 o'clock and I'd like to begin. We have a wonderful evening ahead of us. So welcome everyone. It is once again my great pleasure to welcome each of you to this evening's second annual CSTH lecture series, Beyond Barriers, featuring our nationally renowned speaker and dear friend, Carol Yakuchuk. We have 4 lectures this year and amazing speakers, each prepared to share their valuable knowledge and experiences with respect to bringing quality oral health to people living with disabilities. This series is in step with the vision of CSDH, which reads, highest quality, person-centered oral health care for Canadians living with disabilities. Next month, the student in-person lecture moves to Dalhousie University, and we will be able to share via Zoom in this exciting evening with the dental and dental hygiene students as they interact with expert panelists. Thank you to Shona Hatchie and Lindsay James for hosting. Please look for the posters and future emails to give you more information on these upcoming lectures. I'd like to personally thank all of our speakers for 2026. Also, a heartfelt thank you to Dr. Ramal Balkaran and her education committee, plus Barbara Rand for their combined expertise in poster design, marketing, and having the technical skills to make all aspects of our Zoom platform hum. Also, I must say how much we appreciate Susan Taylor and Joanne Loy at the RCDSO and all your colleagues for guiding us to achieve approved sponsor status for lectures with the college. Members remain the backbone of this robust and growing national society. Thank you to all of our members here tonight for your ongoing stewardship and support. For anyone not yet a member of CSDH, please go to csdh.ca and you can enroll. We'd love to have you to add your help with the ongoing advocacy for people living with disabilities. Students receive free membership just by completing the membership form. Let us take a moment to reflect upon the land acknowledgement which has been written for CSDH. The Indigenous people living throughout Canada include Métis, Inuit, and First Nations. There are over 630 First Nation communities across the vastness of Canada, from Vancouver Island in the west to Newfoundland in the east. Let us name a few of these communities to bring focus to our acknowledgement. Coastal Salish, Musqueam, Blackfoot, Cree, Ojibwe, Mohawk, Seneca, Oneida, Algonquin, Huron, Mi'kmaq, and Boypech. We honor and respect the history, languages, and cultures of these diverse Indigenous peoples who call Turtle Island their unique and traditional home. We are grateful to have the opportunity to work and live in these territories. Now, the housekeeping notes for tonight are reflected in the next 2 or 3 slides, but I'd like to highlight them. The Category 1 continuing education requirements include completing a small quiz at the end of the lecture. The presentation will be recorded, and you may turn off your screen not to be recorded. Please put your device on mute, and you may write your questions in the chat area, and we will address questions after the lecture, time permitting, and the washroom is just down the hall. So at this time, it is my great honor to introduce to you this evening's speaker, Carol Yakuchuk. Carol is a lot of fun, and she is always looking for a new adventure. Carol lived in Manitoba for years and years, and her husband Terry was born there. They moved to North Vancouver in 2009 to avoid the prairie winters. They now enjoy a summer retreat in Manitoba, allowing them to spend a lot of time with their 2 children and 3 grandchildren. They spoil their grandkids shamelessly and without mercy. This coming April, Carol and Terry will mark their 46th anniversary. They just came back from a cruise on the Caribbean seas to celebrate their 50th anniversary of their first date, which was on the 1st of January. I have so many questions, like, was their first kiss a result of the New Year's Eve countdown? And why did Terry take 4 years and 4 months to get Carol to the altar? So many questions.
Too funny.
Throughout her career, Carol has been consistently caring, hardworking, talented, and successful with every facet of the work she chose to be part of. Here are some excerpts from a nomination letter written on her behalf to give some insight into Carol's professional achievements. Okay. Carol Yakachuk's chosen career path has been dentistry through the dental hygiene profession. She has continuously pursued excellence by increasing her academic standard in the profession. Carol started by earning her diploma in dental hygiene from the University of Manitoba School of Dental Hygiene in 1992. At the same time, she also qualified for the orthodontic module and the restorative module, parts 1 and 2. By 2009, Carol had obtained her BSc in dental hygiene in Manitoba, and soon after, in 2012, she had received her master's in health studies and leadership at the Athabasca University in Alberta. Carol has always put her academic achievements and expertise to good work throughout her career. Her passion and trajectory have been to lead and give back in the areas of academia, community service, and to the vast segment of people in our society that have special needs. She has championed children, the elderly, and those folks that live with disabilities. Carol has been involved in the same vein of serving people from 2010 to the present as the coordinator and regional clinical advisor of the Special Smile Screening Program for Special Olympics
Work
International.
involved in that. She has represented Kentucky as a delegate at the ADA.
We got a little bit of over.
Speaker of the House for the Kentucky Dental Association and the president of the Kentucky Dental Association. Among other very roles, very well versed in this topic, has a great rapport with her students. My interactions working with Dr. Depp leading up to coming into this presentation have been nothing but positive. She's very passionate about the topic, about ethics and professionalism, and we're very honored to have her here to be able to speak to us. So without further ado, I will turn it over to Dr. Depp and she'll go through our presentation.
Great, thank you. Let me get the screen going here.
You should be able to, whoever the host is, go in and mute everybody.
Can we see everything?
I can't do that from here.
No, it's Barbara.
Barbara.
Barbara. You're on mute, Barbara.
Where do I do that? I can't find where that it's.
Go on the participants and then, well, it's stopped now, but
It's stopped now. Okay, I will continue. Thank you. I'm sorry for the interruption, Carol.
No problem.
Okay. Carol has been involved in the same vein of serving people, I repeat, from 2010 to the present as a coordinator and regional clinical advisor of the Special Smile Screening Program for Special Olympics International. Another paragraph. Carol has consistently exhibited a penchant for excellence through her high levels of leadership in the responsible and demanding jobs and projects she has taken on. She definitely has advanced the profession of dentistry in her roles as professor and mentor, and with her exceptional contributions to many aspects of society, so well executed through the lens of dental hygiene. Over the years, Carol has worked on many collaborative projects which have produced a spectrum of educational materials, showing her desire to reach out and help build bridges for the betterment of people in our society. Let us look at 3 of 21 projects that illustrate this. From 2001 to the present, Demonstration kits are being produced for perinatal, adult, and long care target groups. A teaching game project named Dental Mythbusters was completed for developmentally challenged individuals in 2004. In 2007, there were 10 how-to video clips produced for mouth care training for caregivers. Okay, Carol is a creative collaborator in the promotion of oral health, well-being for vulnerable populations, and she has pursued countless opportunities to do so, both professionally and through her volunteer experiences. She has been the president of the Canadian Dental Hygienists Association 2007-2008 and governor of the National Dental Hygiene Certification Board 2012 to 2015. Along with her colleagues, she gave of her energy and profound enthusiasm to guarantee the passage of the Dental Hygienists Act in Manitoba in 2005. Carol has received many grants and awards over her storied career. Most recently, she was Canada's first ever winner of the Golisano Health Leadership Award in 2016. This award recognized Carol for her dedicated volunteer work with Special Olympics on behalf of individuals with intellectual disabilities. In October 2022, Carol received the very prestigious award of honorary membership in the American College of Dentists. Ladies and gentlemen, Carol Yakachuk.
Wow, Paul. I mean, I don't think I can live up to that intro. It's so beautiful. I don't know if that's truly me, but thank you so much for that. I'm just going to get my presentation up here. Wait till it pops up. Okay, can everyone see that?
No.
No? Oh, love it. Hold on a second.
You may be sharing the wrong screen because we saw it when you opened.
I'll do it again. Okay, can you see it? Yes?
Yeah.
All right, I'm just going to put it on play. Can you see it? Oh, seriously. Hold on. Let's see how we can get this going. Hmm.
Yeah.
Third
Perfect.
time's the charm.
Yay!
Hallelujah. Here we go. Just give me a second. I'm just going to set it up here. And there we go. All righty. So welcome everyone. Welcome members. Welcome a lot of familiar faces. Thank you again, Paul. And I just feel so very humbled to have such a wonderful introduction and to be invited to speak to you this evening about with the Beyond Barriers lecture series. In the spirit of CSDH's very strong desire, all of us, wanting equitable access to oral health care, I'm very humbly going to share with you some of the tips and strategies that I learned over my meandering career. And for some of you, this is going to be a review because you're the experts already, and you probably can teach me quite a thing or two. And for others, I hope that there's lots of pearls and new information for you this evening. So first of all, I just want to declare that I have no actual or potential conflict of interest in relation to this course. No money is exchanged. I'm not sponsored by anyone. It's just me, retired me. And then, unless otherwise stated, all the images in this presentation are open source and readily available on the internet, except for you'll see some of my area where I live on Vancouver Island. Just to spruce up a few slides, I thought I'd share with you a little piece of the heaven that I live in. So our plan for tonight, really, I thought a great place for us to start is really to dive right into the definition of disability, see how others define it, how we define it, and some of the related terms that I think we all need to make sure that we have sorted out in our heads. I'd love to introduce you, if you haven't met, World Health Organization International Classification of Functioning, and you'll get that from my title of this presentation, it's all about function, caring with people with disabilities. So it really takes the negative out of disability and puts us into a person-centered approach. I'll elaborate on some strategies and helpful tools that you may not be aware of. And
malo.
pardon? And then talk about some opportunities like Special Olympics, Special Smiles, and along with a few key takeaways. So as a academic for many years, I thought I would include some learning objectives, and you'll learn and hear about a whole bunch of different things, but I wanted to focus 4 things that I'm pretty confident you're going to walk away with if you don't know this information, and be able to have a dialogue with members of your team and your colleagues, maybe even your family and friends, because I find oral health kind of gets into just about every conversation around the table. So by the end of this webinar tonight, I think that you will be able to examine and discuss the challenges of current terminology and definitions related to this population, and discuss the prevalence of disability in Canada and its impact on your clinical practice and mine, and propose strategies that could be implemented to better meet the needs of persons living with disabilities wherever you practice. And finally, I'm really hopeful that if you haven't yet done it, you're going to adopt a person-centered functional approach to care. So you know what? I just included this because I wanted to just say that, I was very inspired in 1992 when I was finishing my dental hygiene diploma and sitting through the community practice course. There was a guest speaker, and her name was Rhonda Plett. She was a dental therapist who took dental hygiene training, and she became the director of the Rural Oral Health Program for Manitoba government. And she solely, I'm sure with members of her team, developed a program so that there was in every rural school, there was a dental clinic and a dental therapist. And it was a fabulous program. But I sat in that classroom with Professor Laura McDonald, who was teaching it, and I was so inspired. That's where the flame was lit for me, to work with vulnerable populations and underserved populations. And my story just continues from there. I worked in private practice for 5 years, and then after that, I equate these opportunities to the door kind of cracking open just a little bit. And I took on becoming a clinical director. I did that a day a week. And the next year, there was an ad for a health promotion specialist with the university's outreach arm, where students kind of rotated through all the externships. And we had dental teams that would go into long-term care up to remote areas in Baffin Island to Churchill. You can see my polar bear there. We ran the children's oral health program for Kibblick, the surgery, and just so many places, into institutions for quite significantly developmentally disabled individuals. So through this whole time, I was practicing a day a week, and I went in with a tackle box and an eeler. I sang a lot of old songs that my parents sang when we were on road trips. That's what you do with 6 kids in small cars when we were little. and, found ways to soothe people who were in distress and learned a lot as I went along the path. Paul has already said it all. I think, what, I've kind of done everything I think that dental hygienists can do. I've done research and all of that jazz. A very special place in my heart is First Nation individuals, and I managed the oral health program and retired from there for BC. So, you know what? Just in your career, if you are starting out, don't think about no opportunities. Look for those doors cracking open and just really have the time of your life. And probably lots of people on this call have had these adventures. But I just wanted to share that I've definitely had my hands with gloves on and wet in many, many areas. So I'd like to hear now from you. So Barbara, we have a poll question. All right. So where are you physically located? And you can select an answer. You just click on that drop. It's not showing me. Hopefully other people are seeing that. It just says select an answer, Barbara, and it doesn't really let me answer it. Can anyone else do it?
Mine showed a drop-down menu, Carol.
Oh, good. Great. Oh, good. All right. So we're seeing that people are kind of a little bit here and there, and that's wonderful. BC, Alberta, prairies, a lot from Ontario, the biggest population, and Quebec and Atlantic Canada. So that's fabulous. All right. And we have another poll question coming up here.
Go back. Oops, went back too far. Let's find poll number 2. I think it ended up at the top. There we go.
Okay. What is or was your primary area of professional training? Hopefully we've given you lots of choices there.
I'm going to end it. That seems like a lot of people replied. Share results.
Okay. So we do have a dental therapist and dental hygienists and dentists and others. So fabulous. A really good mix of individuals. No dental assistants today, but we'll aim for more, maybe through our recording. Thank you so much. It's good to know who you are. Welcome. So let's dive right into terminologies and definitions. And I thought, you know what, a really good place for us to start here is that with you, because different words mean different things to different people, and language changes over time. So I want you to close your eyes and just think about, you don't need to share it, but what is disability? If you had to define it with a couple of words, what would that mean to you? What pops into your head? What images pop into your head? Hold that thought for later. All right. So what I'm doing here is I started with you, but I'm going to take this approach like an inverted funnel. We're going to go up instead of down in the funnel. And I'm a dental hygienist, so can't fault me for that. I'm going to just start with dental hygiene. So how does dental hygiene define disability? Well, the Federation of Dental Hygiene Regulators of Canada in 2022 released their latest national competencies document. This competency document, of course, then informs educators what needs to be in the curriculum. It would inform the accreditation team when they go out what they need to look for, and it would inform the national board exam what items to what to test for. So it's a very important document, and persons with special health care needs is how they're kind of grouping and kind of defining disability for dental hygiene practice. They're borrowing this abbreviated, they adapted the definition from the American Academy of Pediatric Dentists, 2016, which is included below. So basically, physical, developmental, mental, sensory, behavior, cognitive, or emotional impairment. And the full definition is really saying that requires medical management, healthcare intervention, and or the use of specialized services and programs. So dental hygienists are very comfortable with this. And just an interesting note is that in 2022, when these new competencies came out, it was the first time that it's written into the clinical component of the competencies. So now there is a part where dental hygiene students need to have that experience to adapt care to persons living with special health care needs. It really was more about the oral hygiene instruction before. So now we're the impetus is on these programs to teach more and deliver those kind of hands-on safety net experiences. So that's certainly something to celebrate. So when we talk about others in our profession, I mean, lots of dentists on the call and a dental therapist. So when we think about dentistry, we're very comfortable with this term, special care dentistry. In some countries, it is actually a specialty, and we do have an amazing dentist in Ontario, Dr. Salome, who's got a specialized clinic, and she has this advanced certification from South America. If you don't know about her, look her up. She's got an amazing, very adaptive dental clinic. So special care dentistry is a term we're very comfortable with. It's also an association. Many of us have presented at their annual meeting. I was just there in Florida in March. Fabulous organization. They have a journal. You might hear in the dental clinic special care, or that person is special, or we're going to refer them because they need special care. So these are all terms that we're pretty comfortable with, and terms that we're using and that you'll hear. The special care dentistry actually, to define it, is really talking more about that the person is going to need specialized dentists to manage the complex care. So it becomes more of an implication of a referral for a specialist. I also wanted to draw your attention. You'll see that I've got 4 colors on the screen, and that little boy with the finger paint has 4 colors. And, disabilities come to life with color. So they actually have meaning. Red means physical disabilities, whereas yellow is cognitive and intellectual disabilities. Blue is mental disabilities, and green, we're talking about sensory perception disabilities. And the actual Canadian Society for Disability and Oral Health logo has those colors in it, and one more. So I really did want to share this video with you tonight, but luck would not have it, nor would the technology cooperate. So I've got the link here if you want to take a photo, but you can easily just search Not Special Needs on YouTube. It's a very quick video, and it was developed as a public service announcement for World Down Syndrome Day. So I'm just going to give you a bit of dialogue on it. A young actress comes on who lives with Down syndrome, and she said, "Special needs? What would be special is if we needed to eat dinosaur eggs. And so there's the dinosaur egg being served in the restaurant to this young man. Or it would be special if a person with Down syndrome needed to wear a full coat of armor. And this is very comedic because this young man is in a full suit and he is in the grocery store, and that makes a point. Or if we needed to be massaged by a cat, that would be special. Or if we needed to be woken up by a celebrity. And in this case, this celebrity is John McGinley. He has a son who is named Max, who has Down syndrome, but he's been like known for his acting in Scrubs and a whole bunch of others. So he wakes up someone and she goes, "Who are you?" So there you go. So I think the thing here to know about this little PSA is that I love it because it's using comedy and humor to really highlight a political issue. And that is that people with disabilities have basic needs that are not being met and often overlooked. And they're boxed into this category of special needs. And so now that you've heard me, you haven't heard the video, but just in your mind, what do you think the term really should be? Because it seems that special and special care are not so comfortable or accepted by members of the disability community. So really what people are saying is they really prefer this person-centered language, this person-first language. They want to be called, a person living with a disability, or something like a person who uses a wheelchair rather than a wheelchair-bound person, or a person who's hard of hearing instead of a deaf person. So it's less labeling. It talks about the person first, and that's really what the general population of people living with disabilities are most comfortable with. But always, you need to ask the source. If you're talking with someone, you have them in your clinic and you're unsure, ask them how they would like to be referred to and what their identity is, and honor that, because they are all different for sure. Members of the autistic community actually feel that that's a real strong part of their identity. And so I've heard from others that they want to be called "I am autistic." But again, person-centered. Talk to the person, find out what they best like. Now, there is a really great article that was developed by the United Nations, and it's called Disability Inclusive Language Guidelines, and we'll share that with you later as well. So let's explore how others define disability. Remember, we're going up this funnel. So disability in Canada, very interestingly, all the provinces pretty well have different definitions. So there's no unified definition. And now when I looked at the federal government, they're all different too. But two stuck out in my mind because I think they add another layer and maybe expand from what we're feeling in our mind is disability, what we're defining. So the Canada Human Rights Act, of course, it says previous or existing mental or physical disability, but it also includes disfigurement and previous or existing dependence on alcohol or a drug. And that's kind of the first time we're seeing that, right? When we've gone from what we think and our profession. Now, the Canada federal government has a disability reference guide. It was updated in 2022. It's quite a good guide, and it is there to serve not only organizations within the government, but any organization. And it's designed to build inclusiveness and to help people treat others with respect. And so This one I really liked because it really now again is getting even more expansive. So complex phenomena is an interaction with the person's body and mind and features of society in which they live. So that's much broader. And it can occur anytime. It can be permanent, temporary, episodic, mild, severe. It can improve, remain the same, get worse. And it can be the cause of the disease or syndrome or illness, or it could be the result of it, or injury or substance abuse. So that is getting much broader for our discussion. And we're all familiar with the World Health Organization. They define disability as part of the human experience. It's part of life. And what they're saying, it is an interaction between a problem with the body or a function. There's the word function again, an activity limitation. So its difficulty could impact the person in a way that they have difficulty executing a task or action, and then perhaps translates into problems experienced by the person involved in life situations. So we've really kind of looked at disability now from, all the way up. But there are a couple other terms that really become part of the conversation that I would like to clarify in everyone's mind today. And that is diversity. That's very common. You hear it a lot. And diversity, just to be clear, that includes one's ethnicity, their race, their culture, their language, their gender, your socioeconomic status, sexual orientation, religion, geographic area, all of the above. And that really makes usually, because I'm Italian and Polish, I kind of feel proud of being that. I'm really just Canadian, but you know what I'm saying. That's my example. Or perhaps I have a patient who lives in a small island way off the west coast of Vancouver Island. So they have no access to any kind of care. They have to boat in, lots of challenges. That does not make that person a person living with a disability. That makes that person living with a huge inequity in access and some challenges. So just to be clear, diversity and disability are different. And you could say within the Canadian population of people living with disabilities, it's quite a diverse group of people. So there's many different populations with subpopulations within that big picture. Inclusion is also really important to our conversation because that's really about the organizational effort in which different groups and individuals with different backgrounds are welcomed, accepted, and equally treated. And that starts even right at home in our dental practices, in community health or public health. We are always working toward inclusion. And when we include people and we lay the foundation for that, people have a really good feeling of equality and belonging. Ironically, however we refer to people living with a disability, that word often does promote a feeling of dependence, not being like others, and exclusion. So words do matter. Good to kind of have these definitions sorted out. And when we talk about people living with disability, I think what we have to think about is yes, they could be all offered, for example, the Canada National Dental Plan. So there's the equality if they fit that slot of 70 to 90,000 a year income. However, when it comes to equity and them coming into a dental office or equity in the community, they need a lot more boxes to get up to the same level as everybody else. So there is a significant inequity in oral health care and access to care for people living with disabilities. So I just wanted to also share that. So what's the prevalence in Canada? Well, globally, 1.3 billion, or 16% of the world's population, lives with a disability. And ironically, in Canada, in 2017 to 2022, we were saying that it was about 23% of people over the age of 15 living with one or more disability. In just 4, 5 years, that has climbed to 27%, or over 8 million people living with a disability in Canada. So quite significant for sure. And this is a great infographic put out by Stats Canada, and it shows you the spread across the provinces, and the yellow bar below it is showing the increase from 2017 to 2023, I believe. Yes. And so just a couple of things to highlight is that when we look across Canada, where I live, it's actually 28.6%. I think that's because people are migrating to the tropics of Canada. Laugh out loud. And Nova Scotia is really the highest at 37.9%. So there's different reasons for that for sure. But I wanted to also say that because disability increases with age, that's one of the main reasons for the increase. There are other reasons as well. And that's that social stigmas have lessened. So people are feeling more comfortable when they come to your practice to disclose that they do have a sensitivity. We also have much improved assessments and diagnostics now today than we even had in 2017. And so we're much more aware and able to screen people quicker. I mean, we can even, as dental hygienists and dental therapists and dentists, when we have a young mother coming into our practice and they've brought their young child and the child is nonverbal and by this age maybe should be more verbal and they're maybe hand flapping, what are we doing? We are screening in our role for autism. And so we would be part of that equation. So everyone is basically much more aware. And as I said, our population is aging, and so we're going to have more biological changes that will result in more disability. So I did mention this is 15 years and older. This is not the total picture because we know 0 to 15, we're going to have a lot more numbers, especially with injury, developmental disabilities, autism, those sorts of things. So they've got a number of categories, and you won't be surprised to see that pain related is the highest one at 16.7%. We know that people with disabilities often experience much more pain than anyone else. And then mental health is also quite high, and seeing is another one. So I've included this slide because I wanted to tell a very brief story. And that is when I every year go to Pacific Dental Conference with a couple of my colleagues, and we set up the CSDH booth to promote how people can become more ready, willing, and able to care for individuals living with disabilities. A common question that we ask is, hey, do you see people with disabilities in your practice? And you know, surprisingly, the number one response is usually, no, we just refer them out. And so when I created the slide and I just looked at my neck of the woods. So, you know, this is the very west of Canada. And you know what? 1.635 million thousand people, no, million people are living with a disability in BC. And so my answer to them is no, you are seeing these people. You may not be aware that you're seeing them, but they're there and they're sizable. When you think 27%, we're verging almost on 1 in 3 people. So in a whole day in your practice, how many people are you seeing that will have a disability? So our conversation tonight, I would be remiss if I didn't talk about models of care as well. And, there's three kind of ones that I think everyone confidently has learned in their professional training. The medical model. And the medical model is really looking at disability as a consequence of a health condition, a disease, or it's caused by trauma. And you know what? When you think of it that way, and I mean, we're all guilty. That's the first thing we look at, the health history or the medical history, right? It really is a bit antiquated because it doesn't give us that full picture. When we think of functional model, that's really saying that disability is caused by a physical, medical, or cognitive defect that is limiting the person's functioning or their ability to perform functional activities. And then the third one is the social model. And the social model is really agreeing that a person's activities are limited not by the impairment so much or the condition, but it's society. It's that whole community. It's the foundation that the person is living within. So barriers then become a consequence of the lack of organization. So enter the very brilliant International Classification of Functioning, Disability, and Oral Health. And so this model was conceived by the World Health Organization. And what they really wanted to achieve is standardizing the language for all health professionals and caregivers and everyone. When you read the research, for data collection, for publishing, so you could be referring to the same thing. And so the model is promoting people within each discipline to develop a categorical number system. So that's not so much what I want to focus on tonight. I really want to talk about how this really, if you will, blends into those three models that we talked about and puts it all together. So you have a person with a health condition, and they are interacting with their environment and the personal factors and things like negative attitudes, inaccessible transportation, public buildings, limited social support. Doesn't that make a lot of sense that a person's environment is going to have a significant impact on how they function in society? And when you think of the medical model, it really was designed to focus on curing, preventing, or treating that disease or syndrome, whatever we're labeling that person as having. Whereas this is really expanding and giving us a holistic approach where we're really thinking quite deeply about meeting the person where they're at. We're not there to fix them. We need to look at them as Dr. Clive Friedman taught me so cleverly, naturally creative, resourceful, and whole. They're whole people. They're coming to us for care, and we need to meet them truly person-centered care where they're at to adapt our care and listen to what their wants and needs are and support them on their journey to health and overall health. So I also really like that just because a person has a health history with maybe identified a disability, that the whole ICF does not label that as negative. It really is giving you a much more open look at the person, a snapshot into their life and how you can meet them where they're at. Now, the CSDH has been working on a position statement because we just think that this is life-changing. We traditionally were taught the medical model, and now this is a paradigm shift where we're really, when we think about person-centered care, we think of, okay, informed consent and that we are presenting the care plan and the person is consenting back. But person-centered care is so much more. So we have developed, and thank you to Shauna Hatchley and Barbara Rand for working with me, and we're working on this, but Shauna has portrayed this, and this is perhaps an easier way to look at ICF and how it becomes integrated into your care. And so all kinds of inputs are that person and the context, their health condition, their body function, all of that, environmental factors. And that is really informing your own personal ICF, your professional ICF assessment of the individual and working with them. And then you are going to collaborate and really have shared goals, integrated care, and you see the happy face. So rather than it being condition focused, you're really thinking about context, integrated care, and function. As I said, it takes the negative out of disability and it really thinks about the person's ability, naturally creative, resourceful, and whole people. And who are we talking about? It isn't just children. Um, it's all ages because it could be anyone with a disability that you can see or an invisible one. These are photos by Rick Godotti, and he is a professional photographer. Amazing, beautiful photos. He's kind of shifted his focus to really celebrate people and their beautiful selves. And some of this might be the images that came to your mind when I asked you to describe disability. But I guess we would all agree now at this point in our conversation that it's way more than that. It's people with dementia. It could be the young, the old. And importantly, people with non-visible disabilities, they're at a real disadvantage if they don't disclose their disability to us. We may be communicating and not altering any of our approach to them. And the literature does show that they're at a bit of a disadvantage because we're assuming that, we're communicating at a level that is appropriate to them, and we may not be. So, what are some of the barriers and what are some of the solutions? Well, there's a lot of barriers, that's for sure. But we're not here so much to lament all the barriers. I've put a few barriers up here that I'm sure you would all agree with. And one could be like previous negative experience and anxiety. And that honestly goes for just about, it could go for any patient coming to your practice. Limited access to resources, money, rides, daycare, all kinds of stuff. Again, that could be the general population as well. I've done a lot of auditing of dental practice, and I have to say, accessible dental spaces are a reality, big barrier. I've been in places with no elevator. I've been in places with the transition on the floor, on the door is just nearly impossible for, the senior woman to try to push her husband with a completed stroke through. Operatories with narrow doorways, all kinds of stuff. So we have a fixed building issue in some cases for sure. Dental IQ could certainly be for the person. It could also be for their family, where they live, for the group home, for the caregiver, for the healthcare aide in long-term care. So this is a definite barrier that we can do a lot to support. When we see that person, we can follow up and do more about that. Communication challenges. Yes, we need to really understand what are the challenges that that person is facing and how can we adapt our communication to them. Behaviors and sensitivities, another big one. And, a huge one for us at CSDH is really not enough 3C oral health providers. We used to say, are you ready, willing, and able? I mean, it still kind of flows, right? But what we really want is to increase the number of competent, confident, and caring oral health providers. I'd say everyone is caring, but where are they on that competency scale? What do they need to add to their professional toolkit and for their team? So that's also a very important one. So we have another poll question now. How are we doing there, Barbara? Did we lose Barbara? Ah, so what best describes your work environment? I'm very interested in knowing where you're working. And let's see what you had to say. So go ahead and complete that. Are we ready to share that? All right. So we've got a really good mix of people, and that's wonderful. So we've got private practice, and we're going to see people in each of these: public health, hospital, mobile practice, education, research, and administration. Fabulous. It's always great to know who I'm speaking with, and thank you for sharing that. We have another one coming up here too. One more poll. So how confident are you in your ability to treat people living with disabilities in your practice?
Oh, yeah, I should say, like, 1 obviously is not very competent, 5 is very competent. Yeah.
Oh, this is a very good point. Thank you, Barbara. And I would say while you're doing that, really the reason CSDH exists, one of our huge goals is to increase the number of 3C oral health providers. And so it's okay to not feel very confident now, but to be a part of CSDH and find a mentor and all of the above. So we do have a gradient here. It's nice to see, kind of a mix between 3, 4, and 5, and a couple that are on their learning journey. And you know what? We're lifelong learners here, so that's just okay. So as I said, some of the information I'm sharing is going to be totally a review for you, and others not so much. So creating a person-centered clinic. I have a quick story here, and that is that one of our members, a dental hygienist, um, decided to open her own clinic. She has a mobile clinic, and she went to all these associations and talked with people who are caring for others or supporting people living with disabilities, and in many cases talked to ambassadors who are living with disabilities to be able to design a clinic that really met the person where they were at. So this saying at the bottom that says nothing about us without us is critical to what we're doing. If you are planning a practice, planning your next step, even if you are already practicing and you want to learn more, hey, I really encourage you to contact the Alzheimer's Society. Go to one of their support groups. Listen and learn from them. At Special Olympics, there's usually an ambassador. It's someone who has an intellectual disability who comes around and can talk with everybody. These are pictures of some of the learning activities that hats off to Dalhousie University for creating these learning activities for Special Smiles, but I wanted to share those too. So nothing about us without us. That is just the best piece of advice I can give tonight, truthfully. So introducing Graham. Graham, let's just pretend. Graham is a real person. He is actually the son of one of our outstanding CSDH members who has kindly agreed to let me use his photo and an example. The rest of the information is fictitious, but I want you now to do a little imagination in your head and close your eyes and think, okay, Graham is coming to your practice tomorrow. And the mom dropped in with the health history that day, and this is what you got. So you don't need to read the fine print, again, fictitious. Graham has autism, mild asthma. He uses an inhaler, has bleeding gums, clenches, grinds teeth, and is overdue for a visit. So I ask you, knowing that, would that be enough for you to go in your operatory, get ready, and really feel like you're going to give this young man the best possible first visit, like a really successful visit? And I know what my answer is no, because 10 things come to mind with autism. That do I anticipate that he might have sensitivities? What do I really know about Graham? And yet, really, in private practice, this is what we are doing. We get a health history, and then, first thing in the morning, we're looking at our charts and going, okay, well, he might have this, so you might be anticipating. So one of the things that several of my colleagues and I did a couple of years ago after the pandemic, we were very curious to know what accredited dental hygiene programs were teaching when it comes to people living with disability. What did they think of the medical model versus the functional model? And were they providing enough hands-on clinical experiences, or what were they? And so what we learned from that is yes, didactically, the students are getting it in the curriculum, the lectures, but when it comes to the hands-on safety net experiences that we appreciate when we're newbies and you're learning and you've got lots of supports around you, they are getting very limited amount. So because we were really, really focused on the functional model and ICF, we decided to create a tool. So this is a sample tool that was vetted through all the educators that attended several focus groups. And the resounding answer was, and our aha moment after we created it is, my gosh, it's good for everyone in practice. It doesn't have to be a person who identifies to the receptionist that they have a disability. It's way more than that. So I'm just going to quickly go through this, but I want to tell you that although it's kind of worded for a dental hygiene student, we've changed this and now it's very generic for all oral health professionals. It's free to use. It's a fillable PDF and it's on the csdh.ca website under tools, and we'll share that later. There's also a supplemental guide that kind of gives you further prompting questions and that sort of thing. So now we know. So let's compare. All we knew about was he had autism, some bleeding gums, those kind of things. So now we know that Graham lives with his mother, but he usually makes his own decisions. He lives with his mother. So this is a question. So now for every person, you're going to know where they live or how they live. And then tell us about your preference for your upcoming visit. Well, he prefers a text message because he finds it hard waiting. So now knowing this, I'm going to encourage them to wait in their car, and then I will text them when I'm ready to see them. How do you communicate? My goodness, you could have someone with a sign language, storyboard, lip reading, electronic communication device. Graham is speaking English and communicates quite well. Do you have any sensitivities? He does. He does not like mint. Sounds scare him, and he needs to know what makes the sound. He really likes his dark glasses. So you can bet I'm going to ask him to bring his dark glasses, but hey, all our operatories usually have sunglasses. And then how do you, feel about, so I've got something. How do you respond in the dental setting? Well, he actually says he's able to keep his hands on his lap during the appointment, but it's hard, but I do try. And he could verbalize. He could be yelling out or exhibiting some stimming, which is like a repetitive rocking motion during an appointment if he gets scared. And knowing now that everyone needs to stop and just talk slowly is kind of his self-soothing method. He needs you to know that. So knowing all of that, we now know that we would be much more comfortable in seeing him. And so even for mouth care, now we know mom sometimes helps him. So that's one tool. And I just really would be remiss if I didn't share about the national plan and give it, a little spotlight. And CBC recently, maybe about a month ago, posted, oh, it was October, my goodness, time flies, that 5 million Canadians are now covered by this national plan. So I'm sure you're really feeling this in your own practices, that there's a lot more people coming in, people with more significant oral health needs. And CSDH has really lobbied long and hard and had the government's ear to just try and ensure that people with disabilities are going to have their needs met, that they were included in this big motion to bring a national plan into place. I think the most positive thing is, and my hat's off to all of you, is that most oral health professionals in Canada have now signed in onto it. All right. So a team approach to person-centered care. You know what? All of you tonight might be the most knowledgeable on this, but if your whole team is not working as one with the same kind of focus, it's going to fall apart very quickly. So what I really want to say is take the time to get everyone on board. There's training you can do. I know all offices generally have, team meetings, and bring it to everyone's attention. Get a champion in your team, some person who's really passionate about that, and they can be, noticing when things go wrong or things we could improve upon in the clinic. And of course, active listening and a morning huddle that morning to say, hey, we have Mr. Jones coming in this morning. If everyone, if you don't recall, Mr. Jones has dementia, and I'll be seeing him in operatory 4 because we'll want to have, the mat and blah, blah, blah going. So then everyone is aware of what's going on. But every member has a unique role, and they need to know what their role is. And it starts at that very first point of contact. Think about nearly 30% of Canadians have a disability. And in a day of you seeing 20 people in your practice walking through that door, you're going to have 5 or 6 that have a disability, whether you know it or not. So it is important that we spend the time and train people and get everyone on board. And then also think about yourself. What other information can you learn? Do you need a mentor? How can we do this? You might be thinking that your clinic is just over the top, too busy to deal with anything else and those extra things. And I totally get that. But I'm not saying that we have to make huge changes. The team approach is important, and I have a couple other suggestions. Consistency, I just wanted to say consistency is very important as well. So if Mr. Jones becomes very comfortable with me as the dental hygienist, where possible, we're going to have Mr. Jones come and see me because it's a familiar face. So prior to the first visit, what can you do? Well, you know what? Everyone's got a website pretty much nowadays, right? And you really need to think about what's on your website. You could have a welcome package. I mean, we used to think about, well, you'd have a big brown envelope and what would be in it, but now you can just direct people to your website. So this isn't for everyone, but depending on the person's disability, I'm sure this list would target most people and satisfy them and help them get ready. So a description of what to expect on the first visit, on their first meet and greet visit. And not everyone's just going to need a meet and greet visit. But if you do the functional assessment questionnaire in advance with the medical history, you're going to be able to pre-plan and know how this is going to be the most successful appointment and relationship with that person. A health history, like I said, and FAQ, as I call it, dental games and recommendations on necessary supplies. Put that on your website. Suggestions on how to create a social story. Dalhousie students created an amazing one, and that I believe is linked on CSDH. But as well, there's a bunch of videos online where you can even post a link to that where the family could put, for example, if it's a 6-year-old with a developmental disability, and you can put his picture right into that cartoon body, and he can actually feel like he's going through a first dental visit. That's going to be like light years ahead for that person because they can practice together. Photographs of staff in the office and a list of steps to take during those first few visits. And you can direct people to that website, you can walk them through it, and you're really going to go that little extra mile. Shouldn't take too long, but it's really going to help people with disability. Here's an example of a social story. And so this one is from an image of pathfindersforautism.org. There's lots of great social stories, but this clinic actually has taken pictures of the outside, the inside, the receptionist, and walking right through each step of a first visit. Imagine how powerful that would be if you do that for your clinic. And now when we think about preparing the office, of course, we all learned that in our training, that you want to schedule the person's visit when the office is quieter, more calm, once you know the person has a disability, that you learn more about that person, right? You know, during the pandemic, we needed to unclutter all our counters and operatory spaces and remove anything that was distracting. Super important still, go figure. So I hope you haven't repopulated all your counters. There's several stories I've heard about uh, individuals that live with autism, and this one story where he was sitting and the specialist is talking to him, and then the specialist and the mom are talking, and he noticed something kind of shiny in the grass over on the counter, grabbed it, bolted out of the clinic, and ran down the street. So it's distracting for people. We need to really be careful about what's on our counters and really be focused on the person. Of course, we need to avoid strong scents and smells. A key thing is flickering lights. So really, if you've got some light bulbs that are kind of acting up, make sure that that's your priority and that you do address it, and avoiding loud voices. So a lot of this is no-brainers, things we learned in training, and some of it is not. Do you have an ability, if you've got music piped into your operatories, do you have the ability to turn that music off in each operatory to lower the lighting? Very important for people who have sensitivities. And, you know, there's an example of kind of a cartoon sensory box here, but really helpful if they have a sensory tool or fidget tool that they're using at home. Great, ask them to bring it, but you should be prepared with some things that would not be harmful, that would be just interesting distractors for them to fidget with. I always had also a whole kind of container of tricks, and that would be like a Sonicare toothbrush and different oral hygiene tools for anybody who was sitting in my operatory as teaching tools, but especially for power brushes. We know they help these individuals a lot, but people can be very sensitive to the vibrations. So I would get them to, this is the sound it makes. I would get them to turn it on and feel it on the outside of your cheek. Is that something that you think you could tolerate? Because people need to have that experience, kind of like the tell show, before they even go and purchase anything. I wonder how many of you are using desensitization kits. I mean, this picture implies that you'd have it all ready to go and it would be a big tub, and that's not the case. But it would be after you assessed the person, maybe had that meet and greet visit, or found some difficulty, or a new young person, perhaps with Down syndrome, who was very anxious about coming in, and you could provide a baggie with a saliva ejector and a glove and something that would kind of work, not work, but replicate kind of the feeling of putting an X-ray sensor in their mouth. So always a great thing, always contextualized to the person as well. So tips for effective communication. Hands down, it has to be adapted to the person. So you really need to be a very quick assessor. And that's where, again, that functional assessment questionnaire or some kind of questionnaire, you might have your own already developed in your clinic, is so important so that you preload your team with pertinent information. But do they have a communication device? I think a really, really important thing for all of us is that we're quick talkers. We often double barrel our questions. So you might ask two questions in one. And we often are really, dental clinics, we're, beat the clock. We got to get going. So if you ask a question and you don't hear a response, you're on to the next thing right away. And that's where you really have to take a deep breath before these appointments and really, really slow yourself down. Everyone has different processing times. You need to be comfortable with some silence after you ask one question at a time, and wait for them to be able to formulate their response and respond back to you. Always focus on that individual. I would sit at the same level. I'd be in my operatory chair, they'd be in the patient chair, and I would be at their eye level, not standing above them. And when I'm talking, regardless of whether they are completely communicative and able to understand everything I'm saying, I'm focused on them and communicating directly with them. If there is an alternative decision maker who is the legal representative and they're in the room, from time to time, I will be, of course, talking with them. But my focus is very person-centered on the person. Of course, calm, soothing, matter-of-fact voice, and we've talked about simple terms, but I hate to generalize because there's some very brilliant people out there who live with a disability. So again, adapt and check any biases that you might have, because believe it or not, we all have some biases. Check that at the door and don't let that interrupt your visit. Lots of visual schedules and reminders on the internet that you can use. There's a lot of pictograms, Autism Speaks resources, Living Well with Autism, like tons of picture cards that are very, very helpful. And you can create your own visual schedule so people really have a total expectation. You can show them visually, we're going to do these 10 things today, and when you complete them, we'll be done. So they are walking through it with you and they can completely understand what you're saying. And even as far as toothbrushing chart at home, also a good idea. Caregivers really do want you to know a few things. I remember when I first started practicing as a clinician, and the practice I worked in, a huge practice, I was directed to not bring in any parents, just bring the child in, better if the parent stays in the waiting room, blah, 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 blah. You know what? They're great resources, invaluable sources of information and support, and they can assist you. And I'm not just talking about parents of little kids, someone who has a loved one with a disability. that person knows that person really well. And if they're not able to speak for themselves, they can share some information with you so they can help you. A key thing that I learned when I started making a resource with Special Olympics Canada was that these parents were saying, please be realistic with your expectations and suggestions for daily oral care and with your treatment plan, because sometimes they're just so over the top, stressed and busy that they can't do a half an hour regimen when it comes to oral health. So keep it simple, that KISS technique, and it has to be realistic care, of course. So this is a picture of Kayla, who's done a desensitizing program at the General Hospital, Children's General Hospital in Vancouver. Outstanding person. And Jack is a person living with autism. And that's his mom. And I just wanted you to see that 10-point visual schedule. And you can see that under 1 to 5, there's just little pieces of Velcro left. So Jack is very comfortable with this now. He has little removable pictograms there. So he's already completed those first 5 steps. They go into the bucket. And when he finishes that 10 step, his mother has already brought him a reward, and that he really responds positively to a positive reward, which is his special cereal. So the point I would really like to make here is that you should have age-appropriate rewards for those who do respond to positive reinforcement after a visit. And, you know, little stickers for a 42-year-old is maybe not going to cut the cake, and it might be insulting. So think about what you've got in your treasure chest in your dental clinic or dental hygiene clinic. So what's in your toolkit and what can we add to it? And really, I'm not talking about major modifications to care. I'm really saying that for most people living with disability, we're talking about minor modifications to care, and that you'll be able to see most of them. Of course, some people have to be referred, but not everyone. So, you know, for example, look at this clear window mask. How many people have difficulty hearing and lip read? On the FAQ that Graham's mom had completed fictitiously, he lip reads. We're all comfortable wearing our masks, but can you imagine the disadvantage for most of those people because they cannot see your lips? So other things that you can do: flavorless products, different color gloves. Here's a story. A dear colleague of mine works in a community clinic in Victoria. She had seen an individual 2 other times who is autistic. And this person came in and she was totally prepared. Things had gone really well for 2 visits. He came into the operatory. The greeting went well. He settled in the chair, hands on lap. He was quite ready with the visual schedule. She washed her hands and she put on blue gloves. He bolted out of the clinic down the street and they had to go and get him. And she said, like, I just didn't get it. What was it? Then she found out he has a severe sensitivity to the color blue. So maybe you need to have different color of gloves too. You really don't know for sure. We talked about the volume control, being able to turn the volume down, being able to turn the lights down, having a room with a door on it, having, you know, if you're making any modifications, widen your doorways, make sure there's room. You know what? I worked with a garden kneeler, like just a little foam thing that I would kneel down on next to a person who was in using a wheelchair. And that worked really well. Something as simple as that. I mean, Lee Valley sells garden kneelers. You can go to Rona and get one. Maybe you have a gym mat in one of the rooms folded up in the corner, because some people For example, someone with cerebral palsy, that might be the best and most comfortable place for them to receive care. Again, very person-centered, visual schedule, pillows and blankets, a weighted blanket. Hey, we all have weighted blankets now, right? Because we've got our heavy aprons, our lead aprons, and they're no longer really in use. You could use them for this, or you might go out and buy some of these, funky color ones or ones with dinosaurs on them. So there's a lot of things that you can do to just add very simple things to your clinic so that people feel much more comfortable and you can build in that success for their visit. And you also have to think about toothbrush handle modifications, space for the caregiver. And like I said, those rewards are also critical. I would be remiss if I didn't talk about this fabulous tool. And Dr. Ari is here on the call, and so is Dr. Clive Friedman, and they were instrumental in developing this tool. Other countries have used this case complexity tool. We heard from Alison McDougall, I believe is her name, from Ireland, where they're hoping to build this as a way of reflecting after an appointment to access a certain level of funding for the person with the disability because they need way more time. So this is something that was developed here for Canada. And this case complexity tool, let's see if we can get that going, has a number of areas on it. Just give me a second to catch up here. Have a drink water. We are almost done with you listening to me talk. So just be patient for a few more minutes here. So what they've cleverly done is color code different levels of people's abilities or what they're exhibiting during a dental clinic. So this can be used by any dentist, specialist. It can be used to transition people back from a pediatric dentist because we're referring so many to this limited number of experts. At some point, these people will age out and they may be able to transition back to general practice. These kind of tools can help all of us have conversations with family members and loved ones and caregivers and specialists and dentists. So it's really good. So color coded, routine is green, moderate, some challenges are exhibited or noted are in yellow, and complex are in red. So I've done a screen grab just of 2 categories, but there's many more categories. So the case complexity tool actually does include communication, and here's a good example. Green, really good communication, moderate, they have a learning difficulty, complex, severe communication difficulty. So you're checking off of these, I would say using it as a reflection after the visit, and you're color coding them and putting in your comments. So there also is medical history, a dental history, treatment needs, and access to oral care and barriers. So it's really a fabulous tool. It is also available at csdh.ca under the tools section for members. And the Canadian Dental Association, you can just Google search this, and they've got a great article and downloadable. So opportunities ahead. Well, CSDH, we all know about them now because here we're all together. For those of you who are non-members, think about joining. We'd love to have you. And, I would say we're really a really good group as far as mentoring others. There's opportunities to get involved in committees and learn as you go. That's how I kind of meandered through my career. I really just adopted that need to know skills, ability. I need to learn, and I got involved in different things to learn more. But I want to talk to members too, because we're talking about whole team approach, everyone on board. And so if you are a member tonight, Fabulous. But what about your team? Get them involved, get them choosing something, because only through all of this work together are we going to make a difference with equitable access to oral health care. I wanted to also just spend one moment talking about Special Olympics. You know, it started in Eunice Kennedy Shriver's backyard. You know, the Kennedys, quite wealthy family, and they had a huge pool with their mansion. And she started inviting individuals with intellectual disabilities into her backyard pool and offering swimming lessons. She had a sister named Rosemary who lived in an institution. And one day they got a call from the dentist and all her teeth needed to be extracted. She started thinking, oh my gosh, if Rosemary's having these issues and we are quite wealthy, what is happening to the rest of Americans who live with disabilities? And so she invited Steve Perlman, Dr. Steve Perlman, to come on board, and together they developed the Healthy Athletes Program. This is one discipline, oral health. It's called Special Smiles. By far the best experience you and your team will ever have working with individuals with intellectual disabilities. It's the largest health organization in the world now. There are over 200 countries involved and a standardized screening form. Special Smiles, what we do is we are screening for oral health findings, oral, in the mouth. We're now implementing a cancer screening approach. We do offer fluoride varnish if they are at risk, and most are at risk for caries. We have boil and bite mouth guards, and in some cases, we're starting to implement more of a custom mouth guard program for those playing contact sports, and a lot of oral hygiene instruction with lots of personalized information and products. So I really encourage you to look to Special Olympics in your area. Typically, each province has a chapter and an outstanding person to work with. I have had such fun and so much satisfaction doing this, and students get involved and really have good experience. And finally, I just want to say advocacy is not so scary a word. For example, you see Miss Pivot in your clinic. She's got rampant caries. She's got a developmental disability that she lives with, and she lives in a group home. So you phone the group home and you learn that she has no ability to control her diet. And the dietitian who is with the government of Manitoba is actually prescribing Boost, Ensure every evening. And you're not confident that they're learning how to brush their own teeth. And so now here you have what started out as a case advocacy approach for your client to try and make a change. Now you can make a bigger change with cause advocacy. And this is how it happens. You notice something, you get into the community and you go, oh my gosh. So I want you to really, really think about how you can make a difference for people in Canada living with disability. I have never stopped. There's always been some little thing that happens and you go off and learn a whole lot as you get involved with these organizations. And it's been so enriching. There's so many neat organizations and other health professionals to work with. Amazing. So your takeaways tonight, if I'm going to leave you with some key thoughts, I really do hope that you've learned a bit about ICF and you really are going to go and embrace that functional approach and really get your team on board or your colleagues. If you're not the owner of the clinic, go and be the champion and start getting that team approach going. Enhance your clinic's aids. There's just simple things that you can do to lay the groundwork for a really successful visit. And you know what? Find a champion. Maybe you're the champion in your clinic. But remember, only minor modifications to care are needed to treat the majority of persons living with disabilities. And another key thing I want to say is people first always. Words really matter. As we know, words change over time, their context. Mindset matters. Just really avoid generalizing and stereotype. Meet the person where they're at. Learn about them. Try using that functional assessment questionnaire or another kind of questionnaire. I mean, the CDA has a number of them too that are great pre-visit ones. Check any personal biases at the door. We all have them. Shrug them off and start anew and build your 3C toolkit. So you're competent, you're caring, of course you're caring, and you're confident. So words really do matter. The government of BC has a really good article on that. I've included my references here, but they're also on the slides. And I'm going to leave you with one challenge, and that really is, what is your next step? Because I really think we can all do a few things and help all of us reach that goal of equitable oral health care and the highest quality care for people living with disability in Canada. I really thank you for inviting me and for the time tonight.